Hello, I'm here to answer the questions that I missed on the quiz from research that I have done and understand acoustic reflex a little bit better. So, one of the questions I missed on the quiz was how retrocochlear pathology and cochlear pathology differentiate. And I did answer the question with retrocochlear pathology is pathology that happens behind the cochlea, and the cochlear pathology is something that happens in the cochlea. Now, what an acoustic reflex would show for the cochlear pathology is that a kind of range. It depends on how bad the hearing loss is, and if the hearing loss is really bad, it can show an elevated acoustic reflex versus if the hearing loss is not very good, it would show, or if it was fine, it would show a normal acoustic reflex. So it just depends on how bad the hearing loss actually is, because the sound that's heard has to be sent through the cochlea and the auditory nerve up to the brain. And if it's unable to make that traveling wave or traveling sound all the way there, then you would see the acoustic reflex be much higher. The sound that's also heard has to travel all the way through the inner ear. So if there's damage in the cochlea, that sound gets blocked from going in the inner ear. For retrocochlear pathology, we actually wouldn't see any acoustic reflex, because if there's damage in the inner ear behind the cochlea, the sounds wouldn't be able to transfer up the auditory nerve to the brain, and you wouldn't be able to hear the sound. So with the interruption, like I said, in the auditory nerve, the sound is unable to travel up all the way to the brain and then be spit back out. Another question that I missed on the exam or on the quiz was identifying the functional hearing loss in patients who are displaying severe hearing loss. And I came up with, if a patient was faking their hearing loss, when they're given an acoustic reflex, they would actually be able to see the movement of the stapedius muscle. And acoustic reflex will show that. So if a person had like sensory neural hearing loss or something in the inner ear that's damaged, they wouldn't be able to see that muscle contracting. So the acoustic reflex wouldn't show anything. If a person is faking it, it would actually show that the muscle is moving and they are hearing the sound, and they're not, that the loudness, it would have to be louder for a person with sensory neural hearing loss to get that muscle to move. And with someone who's faking it, it doesn't have to be as loud. It's muted. So the sound is not evoked. And that's how you kind of know what the acoustic reflex shows for someone who's displaying functional hearing loss. And just that the sound will be much softer and won't be able to send a signal through the stapedius muscle. So those are the questions that I feel confident answering now, how acoustic reflex affects these things. I just had to do a little bit more research on how they affect the inner ear and what happens, or what the acoustic reflex actually shows from these types of hearing loss. Thank you.